Why you should never ignore swollen feet. After 60. It could mean this. I want to ask you something right now. Look down at your feet and your ankles. Are they swollen? Are they puffy in a way that was not there this morning when you woke up? Do your shoes feel tighter by evening than they did when you put them on? Do you press your finger into the skin over your ankle and leave an indentation that takes a few seconds to fill back in? If any of those things sound familiar, I need you to watch every single minute of this video because swollen feet and ankles after 60 is one of the most common symptoms that my patients dismiss, minimize, and attribute to standing too long or wearing the wrong shoes. And sometimes that explanation is correct. But sometimes, and this is what I need you to understand today, swollen feet are the first visible sign of something serious happening inside your body. Something involving your heart, your kidneys, your liver, your veins, or your lymphatic system. Something that deserves medical attention and that, caught early, is far more manageable than when it is discovered late. My name is Dr. Sienna Black. I am an internal medicine physician with over 15 years of clinical experience, and today I am going to walk you through exactly what swollen feet can mean after 60, the benign causes, the serious causes, and the specific warning signs that tell you when swollen feet require urgent medical evaluation. Please stay with me until the end. Before I get into the causes, let me explain exactly what swelling, what doctors call edema, actually is at the physiological level. Because understanding the mechanism helps you understand why so many different conditions can produce the same visible symptom. Swelling occurs when fluid leaks out of the small blood vessels and capillaries into the surrounding tissue spaces. Under normal circumstances, a careful balance of pressures, the pressure inside the blood vessels pushing fluid out, and the osmotic pressure of proteins in the blood pulling fluid back in, keeps fluid appropriately contained within the circulatory system. When this balance is disrupted, when blood vessel pressure increases too much, when protein levels in the blood fall too low, when the lymphatic system that drains tissue fluid becomes overwhelmed or blocked, or when veins cannot efficiently return blood to the heart, fluid accumulates in the tissues. And because of gravity, that fluid pools in the lowest parts of the body, your feet, your ankles, your lower legs, which is why virtually all causes of generalized edema produce swelling that is most visible and most severe in the lower extremities. The question of what is causing the balance to be disrupted, that is what determines whether your swelling is a minor inconvenience or a serious medical concern. The first and most important cause of swollen feet that I want you to understand is heart failure. And I raise this first, not to alarm you, but because it is the cause that most urgently requires medical attention and the one that is most commonly missed in older adults. Heart failure does not mean the heart has stopped. It means the heart is not pumping blood as efficiently as it should. It is failing to keep up with the body's circulatory demands. When the right side of the heart fails, it cannot pump blood through the lungs efficiently. Blood backs up in the venous system, pressure in the veins increases, and fluid is pushed out into the surrounding tissues, beginning in the feet and ankles and progressing upward to the legs and abdomen if untreated. When the left side of the heart fails, it cannot pump blood forward to the body efficiently. Fluid backs up into the lungs, causing the shortness of breath with exertion, and when lying flat, that is characteristic of left-sided heart failure. The swelling of heart failure has specific characteristics that distinguish it from other causes. It is typically bilateral, both legs and feet equally affected. It is worse in the evening after a day of being upright and better in the morning after lying flat overnight, because lying down allows the fluid to redistribute away from the feet. It is often accompanied by other heart failure symptoms: shortness of breath with activity, inability to lie flat without breathing difficulty, rapid weight gain of 2 to 5 pounds over a few days from fluid retention, and fatigue. If you have swollen feet that are worse in the evening, accompanied by any shortness of breath, and that seem to be progressing, please see your doctor urgently. Heart failure is a serious condition, but it is very treatable when diagnosed and managed appropriately. The second serious cause of swollen feet that I see regularly in my practice is kidney disease. And we have talked about kidney disease extensively in this series because it is so common, so silent, and so consequential after 60. The kidneys produce a protein called albumin that is essential for maintaining the osmotic pressure that keeps fluid inside blood vessels. When kidney disease reaches a significant level, it causes protein to leak into the urine, a condition called nephrotic syndrome, and blood albumin levels fall. With lower albumin in the blood, the osmotic pressure holding fluid in the vessels decreases and fluid leaks out into the tissues. The swelling of kidney-related edema is often most prominent in the feet and ankles, but can also appear around the eyes, particularly in the morning before gravity has had time to pull it downward. A characteristic facial puffiness that patients sometimes describe as waking up with puffy eyes. If you have swollen feet combined with foamy urine, which indicates protein in the urine, or with other kidney warning signs we have discussed including fatigue, reduced urination, or back pain, kidney function testing is essential. A simple blood test and urine test can reveal kidney-related edema within hours of your doctor's appointment. The third cause is liver disease, specifically cirrhosis and significant liver dysfunction. The liver produces the majority of the albumin in the blood. When liver function is severely impaired, albumin production drops dramatically, and the same low-protein mechanism that causes kidney-related edema begins to operate. Fluid leaks out of vessels into tissues. Liver disease edema is often accompanied by ascites, the abdominal swelling from fluid accumulation in the abdominal cavity that we discussed in our liver warning signs video. If your swollen feet are combined with a noticeably distended abdomen, jaundice, or other liver warning signs, urgent liver evaluation is needed. The fourth cause is chronic venous insufficiency, and this is actually the most common cause of chronically swollen feet and ankles in adults over 60. Venous insufficiency occurs when the valves inside the leg veins, valves designed to prevent blood from flowing backwards as it travels upward toward the heart, become weakened and fail. Blood pools in the lower leg veins. Pressure inside those veins increases. Fluid is pushed out into the surrounding tissue, and the result is the chronic ankle and lower leg swelling that so many older adults experience. The swelling of venous insufficiency has a characteristic pattern that distinguishes it from cardiac or kidney edema. It is typically worse by evening after prolonged standing or sitting, and significantly better in the morning after overnight elevation. The skin over the lower legs may become discolored over time, developing a brownish or reddish stain from iron deposits left by red blood cells that have leaked through the stressed vessel walls. In more advanced cases, the skin becomes thickened and leathery, and may develop open sores called venous ulcers that are very slow to heal. Venous insufficiency is not immediately life-threatening, but it is progressive if unaddressed, and the skin and wound complications of advanced venous disease can be serious, particularly in people with diabetes or impaired circulation. Compression stockings, graduated compression that is tightest at the ankle and progressively looser toward the knee, are the cornerstone of venous insufficiency management and can significantly reduce swelling and slow the progression of the condition. The fifth cause is medication side effects, and this is one that is frequently overlooked because patients do not typically connect a new swelling in their feet to a medication they may have been taking for months or years. Many commonly prescribed medications cause peripheral edema as a side effect. Calcium channel blockers, a widely used class of blood pressure medications including amlodipine, are among the most common pharmaceutical causes of ankle swelling, affecting a significant proportion of people who take them. The swelling from calcium channel blockers is caused by dilation of small arteries in the legs that increases capillary pressure and drives fluid into the tissues. Corticosteroids, including prednisone, cause sodium and fluid retention that produces generalized edema, including in the feet. Certain diabetes medications, including some of the older thiazolidinedione drugs, cause fluid retention. Non-steroidal anti-inflammatory drugs like ibuprofen cause sodium retention and kidney-mediated fluid retention. And certain antidepressants and hormonal medications can contribute to edema in some people. If your swollen feet began or worsened around the time a medication was started or its dose was increased, please mention this specifically to your doctor. In many cases, a medication adjustment, substitution, or addition of a diuretic can resolve medication-related edema without requiring the cessation of an otherwise necessary drug. The sixth cause I want you to be aware of is deep vein thrombosis, a blood clot in the deep vein of the leg. And I want to address this separately from the other venous causes because it represents a medical emergency rather than a chronic condition. Deep vein thrombosis typically presents as swelling in one leg rather than both. Unilateral swelling is the key distinguishing feature. The affected leg is often painful, warm to the touch, and may appear red or discolored. Unlike the bilateral swelling of heart failure or venous insufficiency, which comes on gradually over hours and days, DVT swelling often appears more acutely and is associated with a sense of heaviness or pain in the calf that worsens when you flex your foot upward. If you have one leg that is swelling more than the other, particularly if it is painful, warm, and red, please do not wait. Go to an emergency room or urgent care immediately. A blood clot in the leg can break off and travel to the lungs, causing a pulmonary embolism, which can be life-threatening. Time is critically important with this diagnosis. The seventh cause is lymphedema, swelling caused by impairment of the lymphatic system, the network of vessels and nodes that drains fluid from tissues and returns it to the circulation. Lymphedema can result from damage to lymph nodes from cancer treatment, including surgery and radiation, from infection, or from a primary developmental abnormality of the lymphatic system. Unlike the pitting edema of cardiac or venous causes, where pressing a finger into the swollen tissue leaves an indentation, lymphedema often has a characteristic non-pitting quality in its more advanced stages because the accumulated lymph fluid contains proteins that cause tissue fibrosis over time. The skin over lymphodematous tissue becomes thickened and may take on a cobblestone appearance. Lymphedema is a chronic condition that requires specific management, including complete decongestive therapy, specialized compression garments, and lymphatic drainage techniques performed by trained therapists. So how do you know when to seek urgent care versus routine medical attention for swollen feet? Here is the guidance I give my patients. Seek emergency care immediately if your swollen feet are accompanied by chest pain, shortness of breath, or difficulty breathing. This could indicate heart failure or pulmonary embolism. Seek emergency care immediately if one leg is significantly more swollen than the other and is painful, warm, and red. This could be a deep vein thrombosis. Seek same-day or next-day urgent evaluation if your feet have swollen rapidly, gaining 2 to 4 pounds of fluid weight in 2 to 3 days, as rapid fluid accumulation suggests significant cardiac or kidney decompensation. Seek a prompt appointment within the next few days if your swelling is new, bilateral, progressive, and you have not yet had an evaluation. And mention swelling at your next routine appointment if it has been present for some time, is stable, and is accompanied by no alarming associated symptoms, though even stable chronic swelling deserves investigation and management. I want to close with something simple and direct. Your feet are talking to you. They are at the end of the longest circulatory journey in your body, and they reflect the health of your heart, your kidneys, your liver, your veins, and your lymphatic system with remarkable sensitivity. When they swell consistently, when that swelling is new or progressive or accompanied by other symptoms, they are asking you to pay attention. I am Dr. Sienna Black. Please share this video with someone you love who has been dismissing swollen feet. Hit the like button, subscribe to Healthy After 60, and I will see you in the next video. Take care of yourself from head to toe. Before I close today, I want to spend a few more minutes on practical home management strategies for swollen feet. Because whether your swelling is caused by venous insufficiency, medication side effects, or simply prolonged standing and sitting, there are meaningful things you can do at home to reduce discomfort and slow progression while you work with your doctor on the underlying cause. The first and most immediately effective intervention is elevation. When you elevate your legs above the level of your heart, Gravity works in your favor rather than against you. Fluid drains from the feet and ankles back toward the central circulation. To be effective, leg elevation needs to be sufficient. Your feet need to be higher than your hips, which means lying down with your legs propped on pillows rather than simply sitting with your feet on a footstool. Even 30 to 60 minutes of adequate leg elevation in the afternoon can produce meaningful reduction in end-of-day swelling for people with venous insufficiency or mild cardiac edema. The second intervention is compression. Graduated compression stockings, available in various compression levels from light support to medical grade, apply external pressure to the leg that mimics the pumping action of healthy vein valves, reducing the pressure inside the superficial veins and pushing fluid back toward the circulation. They are most effective when put on first thing in the morning before you get out of bed, before gravity has had time to pull fluid into the feet, and worn throughout the day. If you have arterial circulation problems in the legs, compression stockings may be contraindicated. Check with your doctor before using them. The third intervention is reducing sodium intake. Since sodium retention is a component of the fluid accumulation in almost all types of edema, reducing dietary sodium can meaningfully reduce the total fluid burden on the body. This does not require extreme sodium restriction. Even reducing from a high sodium diet to a moderate one by cutting out the most sodium-dense processed foods can produce a noticeable reduction in swelling within a few days. The fourth intervention is movement. The calf muscles act as a secondary pump for the venous circulation. Every time you contract your calf muscles, they squeeze the deep leg veins and push blood upward toward the heart. Regular walking, calf raises, ankle circles, and frequent position changes throughout the day activate this muscular pump and reduce venous pooling. If you spend long periods sitting, whether at a desk, in a car, or watching television, make it a habit to get up and walk for 2 to 3 minutes every hour. Even simple ankle pumping exercises, flexing and pointing the foot repeatedly while seated, activate the calf muscle pump and can reduce lower leg swelling during prolonged sitting. The fifth intervention is staying well hydrated. This seems counterintuitive. Why would drinking more water help when your body is already retaining too much fluid? The answer lies in the relationship between hydration and the kidney's regulation of sodium. When you are mildly dehydrated, your kidneys conserve sodium more aggressively because sodium retention is the mechanism the body uses to hold on to water. This paradoxically worsens fluid retention in the tissues. Adequate hydration allows the kidneys to excrete sodium more freely, which reduces the osmotic driving force for tissue fluid accumulation. 6 to 8 glasses of water per day supports this process. Now I want to address something that I know concerns many people with chronically swollen feet, and that is the appearance of the skin over time. As swelling persists, the skin over the lower legs becomes increasingly vulnerable. It stretches and thins. Small amounts of protein-rich fluid that leaks through the skin surface can become infected. The altered circulation reduces the skin's ability to heal minor injuries. And in people with diabetes, the combination of poor circulation and reduced sensation creates conditions for serious wound development that can progress rapidly. Protecting the skin of swollen lower legs requires daily inspection, looking for any new cuts, blisters, areas of redness, or skin breakdown. Moisturizing the skin daily with a fragrance-free lotion reduces dryness and cracking. Wearing properly fitting shoes that do not create pressure points. And seeking prompt medical attention for any wound on the lower legs or feet that does not begin to show signs of healing within a week, particularly if you have diabetes or known circulation problems. I am Dr. Sienna Black. Thank you for watching Healthy After 60. Please share this with someone who needs it. Subscribe for new videos every week. Take care of yourself from head to toe. I will see you in the next video. One last thought before I truly sign off. So many of the patients I see who have been living with chronically swollen feet for months or years tell me the same thing when we finally sit down and talk about it. I did not want to make a fuss. I thought it was just part of getting older. I kept meaning to mention it but never got around to it, and I understand that impulse completely. But I want you to hear this clearly. Swollen feet are not a small thing to be endured quietly. They are a signal from your body that deserves your attention and deserves a doctor's evaluation. Whether the cause turns out to be something straightforward and easily managed or something more serious that needs prompt treatment, knowing the answer is always better than not knowing. Make the appointment, show your doctor your feet, let the conversation happen. Your body has been trying to tell you something. It is time to listen. I am Dr. Sienna Black. I will see you in the next video.